I'd like to welcome everyone to the Health, Human, and Social Services Committee meeting. First order of business is to approve last month's committee meeting minutes. Motion made by Supervisor Simpson, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. Okay. First on the agenda, we have Robert York, Mental Health.
Good morning, everyone.
Good morning.
Okay, I believe everybody has a copy of my agenda and attachments. First item on my agenda is a request to reappoint one of our Community Services Board members, Kimberly Brayton, currently serving as the chairperson for our Warren County Community Services Board. Our boards have 4-year terms, and so the term would run from January 1st, 2017 through December 31st of 2020.
Motion made by Supervisor McDevitt, second by Supervisor Simpson.
May I just make one
Yes.
comment? Having used to going to a lot of your meetings, Kimberly, I believe is a college professor down in Albany, but she came from Washington, didn't she? And her father-in-law is a constituent of mine, but I think she was a forensic psychologist for the FBI in Washington. I think that was some of her background. Okay, so highly qualified, good person, and a great reappointment. Yeah.
All right. Thank you for that. Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried. Item 2.
All right, next request is to approve our 2017 contracts with various community mental health, substance abuse, and developmental disability agencies. What you'll see is an attached Schedule A that details the agencies that we contract with and the amounts. The majority of this is state aid that we pass through to the agencies. We always get this resolution set up for the
Motion made by Supervisor McDonald, seconded by Supervisor Bramer. Discussion? All in favor?
Aye.
Opposed? Carried.
You gotta be on it more than that.
Yeah,
that was quick.
You did good, babe. You did good.
I just had it.
You were vocal for everyone.
I just had a question.
No. Go ahead.
How do these line up with, are there big increases, significant increases from last year?
No, relatively flat. In fact, the state passed through a 0.02%
Okay.
COLA that we did, that's built in here.
Okay.
But from the previous year, yeah, flat.
Okay. Thank you. Thank you, Mr.
Sorry about that, Supervisor. Item 3, please.
There's also a resolution request here for a contract with Waite House. This is for respite services. We do this contract a little bit differently. These funds are held in our admin budget. They voucher us per service for this, which is crisis respite services at the Waite House. We actually have funding, it's state aid funding, 100% state aid, to do crisis respite, hopefully diverse from emergency rooms and machines.
Motion made by Supervisor Strauss, seconded by Supervisor Simpson. Discussion? All in favor?
Aye.
Opposed? Carried.
Next request is for a similar contract that we hold with Northeast Parent and Child Society. Again, for a 2017 contract, 100% state aid. This also is for respite services. These respite services are both planned day respite and some overnight in the therapeutic foster care. When there's opening there, we can use that for crisis respite also.
Very good. Motion made by Supervisor Bramer, seconded by Supervisor Simpson. All in favor?
Aye.
Opposed? Carried. Anything else for us, Robert?
Yes, one more. Okay, the last resolution request is to transfer funds from one contract to another for 2016. This is some unspent funds for 2016 in our Parsons Child and Family Center contract, and there's currently a deficit at the Association for Mental Health outpatient clinic. They lost their child psychiatrist this year. They have their adult psychiatrist also resigning, so they've been feeling stressed, stretched in terms of their staffing. So we would like to be able to move over the 100% state funds that Parsons did not spend and help out the Association for Mental Health.
Okay. Motion made by Supervisor McDevitt, second by Supervisor Stroud. Any discussion on this item? All in favor?
Aye.
Opposed? Very good, sir.
Thank you, Rob.
Thank you, Robert.
Thank you.
E, when you are ready.
Very much.
So festive again. So jealous.
First time,
Second
time over
So, item number 1 is permission to amend the contract with KLC Property Management to include a fee of $20 per snow removal of the walkway if the snow is heavy or if there's more than 6 inches of snow at the Bolton Meal site.
Do we need to actually have a resolution for this? Wasn't it anything other?
It's amending the contract?
Oh, just amending our contract? Oh, okay, okay.
So that $20 is for the whole year?
No,
No,
it's
per-
per occurrence.
Oh.
Yeah, yeah.
That's a good
Geez,
deal,
I
huh?
thought-
That'd be a
yeah.
heck of a
That
deal,
would be
man.
an awesome deal, no.
Okay, I'm sorry. Motion made by Supervisor Bramer, second by Supervisor Frazier. All in favor?
Aye.
Aye.
Opposed? Carried.
Okay, item number 2 is permission to increase the contract and renew it with Clements Firm for the 2017 contract year in the amount of $16,000. Our current contract is $11,000 and we increased it last month for this year to $16,000, so I'd like to get it already set up for next year.
Okay. Motion made by Supervisor Frazier, second by Supervisor McDevitt. Discussion. All in favor?
Aye.
Opposed? Carried.
Item number 3 is permission to authorize a one-time payment to the Cedars, which is our Glens Falls Queensbury meal site location, in the amount of $1,809.37 for repairs to the AC unit in the kitchen. This unit is only used by the OFA staff. The current contract reads that we don't pay for any repairs to the heating systems, the water systems, things like that. But because this is just for our OFA staff in the kitchen area, I think we should pay for this expense.
Does it say who's doing it, Dee?
It was already done, actually.
Oh, it was already done?
It was done in July,
Okay,
but they didn't submit the payment until just now.
gotcha. Okay. Motion made by Supervisor Bramer, second by Supervisor McDonald. Go ahead, Supervisor.
Did they ask us to pay? They did, yes.
We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried.
Item number 4 is permission to amend the current contract we have with Northway Services for repairs to our kitchen equipment, to increase it from a total amount not to exceed $1,000 to a total amount not to exceed $2,000. And then also to add Countryside Adult Home to this contract, as Countryside Adult Home does not have a current contract for repairs to the kitchen equipment. And that one would not exceed $1,500 in a year.
Motion made by Supervisor Strauss, seconded by Supervisor McDonald.
Can I just have a question? Is it, this is all purchased equipment, it's not leased equipment? Yeah.
Correct.
So so you're happy with Northway?
Yes.
Yeah, so he does a pretty good job? Yeah.
Yeah, and at Countryside, typically the maintenance staff will try to do any repairs, but there are times when we've had to call them in.
Okay.
And we don't have a current contract, we've been working on it, so I thought this would be the opportune time to add Countryside in there as well.
The Northway Service will do repairs at the Countryside Adult Home for what, up to $1,500 or how?
Up to a total amount of $1,500 in a year.
And
Typically, the repairs aren't that much,
Yeah.
They're usually about $400 or $500.
All right, so this is just like an account set aside for them to do any repairs that might need to be
Correct.
needed? Yeah. Okay, fine. And that's Peter that does that? He does it himself?
Yes.
He does it, yeah.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
Did we have a motion this?
Yeah.
Shabbat that does that. Oh, he's all over the place.
Item number 5 is permission to submit the application to New York State Office for the Aging Grant funding for the New York Connects program, in the amount of $85,880 for the program year of October 1st, 2016 through September 30th, 2017.
Motion made by Supervisor Bramer, seconded by Supervisor Stroud. Discussion? All in favor?
Aye.
Opposed? Carried.
And the last item I have is permission to temporarily increase the hours of our part-time typist from 25 hours a week to 30 hours a week, for a maximum time frame of 3 months. And this is to help us get all of the backlogged information from the Pure Place transition into the system. And the monies are in the budget for that.
Motion made by Supervisor McDevitt, seconded
It is
by
in the budget.
Supervisor Bramer.
Yeah.
Is this just for 3 months, Dee?
Yes,
or-
just for 3 months.
Okay, and then after that,
We wouldn't need it.
we should be all set?
It's just to get all the information in there, because right now we're a little bit backlogged as well with HEAP applications and the Medicare insurance renewal applications.
Okay. All right, we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
That's all I have.
Nice job, Dee. Thanks, thank you.
Thank you.
I'll let,
Go ahead.
Ready when you are, Cynthia.
They're watching her on camera.
he can't help himself.
No one is watching this.
Even the brand.
I know him much too well, myself.
Of social services.
Be the director of the open door.
Yeah, that's fine.
Never want to owe him money, not a good idea.
Me and my father got to be good friends, and
Yeah.
we heard the story.
Yeah.
He's good.
That means he knows how to collect his
He
money.
does, you got it. Thank you.
Right, thank you.
Sometimes it's not very pleasant.
No, I know all about it. I've been on the pleasant side of it.
I'm ready when you are, Cynthia.
Good morning.
I'm gonna go ahead and do countryside first, since she is here, so she can help design the countryside.
Okay.
So the first agenda item is to increase the hours of one of the institutional aides from 8 hours a week to 24 hours a week. As you can see, this particular person has been averaging a great amount of overtime, and apparently she's interested in making an hour anyway, so, that would actually save overtime costs, and give her some extra hours that she could have.
Okay. Motion made by Supervisor Simpson, seconded by Supervisor McDevitt. Any discussion on this? All in favor?
Aye.
Opposed? Carried.
Second is actually to fill a vacant position of the same caliber and institutional aide, which has been vacant since 2013, it looks like, but also to fill that position will also help to minimize the overtime.
Okay, I'm sorry. Motion made by Supervisor Bramer, seconded by Supervisor Frazier. Discussion on, all in favor?
Aye.
Opposed? Carried.
There's some pending items that are on the agenda, I'm not sure if you wanna wait for the motion to any others further.
Was this the laundry, was that the discussion of?
No update on it, we're still
Okay.
trying to figure out with, Kevin Hajos and, Jeff Henderson whether or not our current system, septic system can handle it.
Okay, but monetarily, it makes sense to go that way?
Monetarily, yes.
Okay, all right. And then discussion to continue pertaining to whether the senior aide staff at Countryside Adult Home who had taken on additional responsibilities since the director position should be, okay. Yeah, we did talk about this item too. We did say we were gonna bring it back this month. What is the committee's thoughts? We still have yet to find a director. And is it just the one woman that's been taking on the extra responsibilities, or?
There's actually two.
There are, both of them are? Okay. So right now, we're not compensating them at all, correct?
I think there was some question with regard to, how that was gonna be done. I think that was really the biggest issue. I just had a brief conversation with Chris Manager about it, as far as out of title pay, things like that, because these are union positions.
So was it a civil service item or a council item?
I'm not really sure where that was left. Which
I
is why
can't
was
remember
saying
that one either, yeah.
We may wanna waive for this issue.
Trish indicated that for civil service requirements, they didn't meet the educational requirements, so therefore they couldn't be paid out of title for the director position. But I think Maureen was still looking to try to compensate them in some way.
Supervisor Frazier, you had a question?
I was just curious how much extra time they're having to put into this that we're not paying them for.
I couldn't say specifically. I know I do provide some assistance as well.
Right.
Kind of guide them through it, because we have the computer system on my computer as well, and Julie has it as well, so that we can kind of help out and walk them through stuff. I think it's just more added responsibility. There is some additional time that they put in for it. But definitely the responsibility is greater than what they've had.
Thank you.
Supervisor Stroud?
Do they put in time above and beyond their usual time? I mean, beyond 40 hours? So, and they aren't being compensated for that?
For some of it they have been, but not all of it, no.
So did they get time and a half for,
In those situations, yes, one of them has.
so what are they not being compensated for then?
The time and a half, they were only paid on one occurrence for that. They have not been paid on a regular basis.
Why is that?
They haven't specifically requested it, and I think they're trying to do it through this route, to do like an additional amount for the work they've done.
Well,
And I would suggest maybe waiting until the new director is in place, and then going back and trying to figure out how much extra they've done and what they should be compensated for. I don't know what Julie.
They should be paid something.
Supervisor Bramer?
Thanks. Are they keeping track of their overtime?
Yes,
They just haven't put in a request to be paid for it?
correct.
Supervisor McDonald?
Perhaps Julie can speak to some of this.
I think they're really looking for, Trish has recommended a temporary position that would offer them more money for the extra responsibility that they would be qualified for, because we can't pay them out of title
Right.
the way it's set up now. So Trish has recommended a temporary position. And at that point, I don't know if they're planning on putting in for the overtime at the newer rate of pay, or if they are just considering it their regular workload. I process their payroll, and they have not mentioned that we owe them any overtime. I'm not aware of any overtime that we owe them. So, I know Maureen's gone out several times. I've been with her many times, and they're just frustrated over the responsibilities that they've taken on and are hoping to be compensated for that.
Okay, so this position is going to be for the both of them?
It started out as one, and then we were informed that the second one would also be included, that they're sharing it. So that was an add-on after the two people asking for it.
Supervisor Bramer?
Thanks. Where are we with filling the director position? I mean, if they qualify, why aren't we putting one of them in it?
They don't qualify.
Oh, I thought she said, okay.
No, they don't know.
They don't qualify. We have 2 applications. Both the candidates have been interviewed. I was unable to make the second interview tonight, so I am actually meeting with the second candidate probably later today. Those 2 people are fully qualified, so we're hoping to keep one of them.
Supervisor Simpson?
I just just wonder, why would we, create another position and not just compensate them overtime?
I'm not sure whether
If they don't qualify.
overtime, frankly, for more than if they are putting in extra hours, I apologize, I cannot speak to that. But as Julie says, the time that they have requested, they've been paid overtime for it. Again, it's possible just, they're just frustrated with, unfortunately, the departure of the prior director who isn't in here. And, the fact that, despite Maureen and myself trying to make it up there on a regular basis and Julie going up as well, there was really no second in command. There was no assistant director, there's no other staff person. These are senior aides, people that we're talking about. They've worked there a long, long time. They're frustrated that they are entitled to overtime if they're working there.
Yeah.
Supervisor McDonald?
I think from a morale standpoint, not just from them, but also the trickle down of, other employees seeing, okay, so if we step up, we're gonna be in this gray area in the weeds, that's not really good for the whole morale standpoint. So I think we should really try to really nail down what exactly they're doing, cross-reference that with what the job applications, qualifications specify, and try to just give them a stipend as soon as possible, really. I don't necessarily know if we need to go to the point of creating a new temporary position, but I would prefer to not have to wait until somebody's in that seat to figure all this out.
See what you've started, Dee. Can we at least keep them updated? So in other words, you're having these interviews, let them at least know what's going on and where, okay, all right. They are, okay. Yes, Seaver.
I think as a county as a whole, we've tried to get out of stipends. We saw in this budget year coming in that we've made stipends part of salaries. That's been a goal over the last 3 or 4 years. So personally, I would be opposed to any type of stipend, but I do think if they're eligible for overtime, they should be applying for it. They should be asked. But if you're working more hours and you're eligible for it, I think, the head of the overall agency is going to have a requirement to make sure that they understand if they're working on that, they need it. I understand it's a responsibility, but it's on us to make sure that that position for the director is filled as soon as possible, and, the support is given that way. I mean, this isn't how long has it been? 2 months. 2 months, so I think it's reasonable to say it could take that amount of time to find a director, and, we should be aware that perhaps we need an assistant director in the future, and maybe that's more of what we should be looking at for succession planning.
Supervisor Strauss? Okay. Yeah,
So,
yeah.
and I would not suggest a stipend, and I agree with you that if they are working overtime, they should put in for it, and they should be paid for it, so I agree with pretty much everything you said.
So I think there's agreement as to paying them for the extra duties they've done, but the question is, do we pay them at the rate of their category, or, as Trish said, since they're working out of title, should they be for the work they're doing that's not within their title, should they be paid for that title's overtime, right? So that is the question, the way I understand it. So it's not a matter of whether we're gonna pay them overtime at their salary. The question seems to be, are we gonna pay them overtime on their out-of-title category, right?
The director position is a non-union position, so I don't believe there's ever any overtime paid for that.
Right, no.
So, we're talking about apples and oranges here. I mean, these are union positions that they're in right now, so they're saying that they're taking on responsibilities of a position that's completely out of the union. So, there's really no comparison. There was no overtime rate for a non-union position.
Yes, but this new position that Trish is coming up with, isn't that going to, I think that's the position you're referring to, right, John? Not
Yeah, I'm just, which, since...
I apologize, I can't answer that. I don't know anything about that.
So Trish seems to think it might be all right for them to be treated as temporary and then sidestep.
Conversations I've had with Trish, that really is the only option because of the union, non-union titles.
Yeah.
It would be the only way to allow them to be paid more money for the responsibility that they've taken on.
Well, that seems reasonable to me, but, all right, let's see where...
Again, I don't think it would be overtime though. I think they're
Yeah.
looking for more money for their straight work hours.
So when they put in something over 40,
If they're getting a temporary title, then any overtime that they claim would be paid at the overtime, at the new title rate.
yeah, are you saying then that part of their 40-hour work week, they are doing these director duties?
Yes.
And are they keeping track of that as well?
I don't know if they're keeping track of that specifically, no.
So, all right. Well, they're entitled to some compensation, we just don't know where to go, I guess.
Well, and realistically, I mean, we're looking probably at 2 months before we get, I mean, by the time you get finished with your interviews, right, and make a decision, it's probably not gonna land before the December board meeting, will it? I mean, you think so?
Depending on if we were to, the commissioner has interviewed both candidates. I have interviewed one. So again, I expect to speak to the other person. I do believe we could make a choice between the two candidates, and it's possible that a person could start pretty immediately.
They would not have to give notice for their other jobs, or?
But,
Okay.
like I said, if we could make the decision by next Monday, then it could be pretty quick.
We couldn't do an audit committee resolution, could we, depending on what Trish comes up with? Would it make sense if we had Trish get back to us in the form of an email and do an audit committee resolution to compensate these people?
I would like to say that I have not been involved
Right,
that
but that
much
would
with
be-
it, had one conversation.
coming up.
The fact that I'm sitting here in the meeting right now, I don't wanna promise anything. I know,
We could get this, yeah, if we hurry with Trish, we could get this for, personnel next week.
well, like I'm saying, I don't really know the ins and outs of what they're requesting. So I hesitate to have you make a resolution to do that before we really even know what we're talking
Okay,
about.
all right, so why don't we just leave it on pending? Obviously, we need to hear from Trish first,
I would agree
and we'll
with
go from there, okay? Okay, is that all we have for Countryside then? Other than the overtime report, right?
I don't have an overtime report for Countryside.
I could get one together for you. I do plan on going up there tomorrow, after the board meeting. So I could get one together and email it to all of you, but I don't think that they have been keeping track of that. I mean, they've been keeping track of the overtime for each pay period, just not on that form I usually get together.
The overtime, the Countryside is listed in our expense report.
Oh, okay.
Attached to our information. I don't know if there's split numbers on here. But there is the overtime salary. We are under budget right now, looks like, for Countryside.
It would be under page 2 of your expenditure report. Countryside, overtime, and falls under the 120 category. So what we've paid for the month of October in overtime salaries, this is $38.89, which, it may be a little high. I don't know what the monthly,
There's one holiday in there.
right, there's holiday, and they've been short of staff. That's why we were asking to fill some of these positions and increase the hours because of that.
Supervisor Seaver.
I guess in terms of following this issue, is Trish around to come upstairs and talk to us?
Not today. We've got public health waiting outside. I think we can, I can get in touch with, Trish and send you guys emails. Okay?
Sounds good.
Okay, moving on then to social services, if the committee's okay with that.
Great.
Okay,
Thank you, Dee.
first agenda item we have is a request to fill an upcoming vacant position of caseworker.
Yeah, so moved.
Motion made by Supervisor Brammer, seconded by Supervisor Seaver. Any discussion? All in favor?
Aye.
Opposed? Carried.
So no pending items, we have discussed deciding the update for the director position, any conditions?
For the revenue and expenditure report, the expenditures look great. If we keep going the way we are, we should come in under budget for 2016. Not by a lot, but hopefully a little. Our revenue is a little bit slow, but I'm not concerned at this point because the state is 3 months behind. So we should be getting 2016 money well into 2017. So I run both reports first couple months of the year. So I really don't have any concerns there. And our overtime's been down, so we're gonna appreciate it while it lasts.
Mm-hmm. Very good. Any other questions for social services? Okay, thank you, ladies.
Thank you.
Thank you.
Yeah.
No, and that's the thing, you know, you see, you know, on the lower end spectrum.
Good morning, how are you?
Thank you.
Never know who your partner knows, so I just don't know.
You know, they're probably put in the extra time.
No,
Well, that's not.
Yeah.
Why would I want to run them around, you know?
Yeah, I know, they're doing the extra work, but, yeah, I know, I run across that in the town, I don't know.
I did it too, thank you.
The civil service thing, it does.
No, it's a good catch. Absolutely.
Well, it's just,
Good morning.
sometimes putting square peg in round hole.
But that is a good point.
No, it is.
I'm ready when you are.
Okay, good morning,
Thinking
everybody.
about how it
Morning.
works the standpoint of other employees and.
Always fun to start the week off with this meeting. Anyway, first thing, on our agenda, we would like to request a resolution to award the bid following our, RFP for obtaining CPA services to audit our Medicaid cost report to the lowest bidder, which is Bonadio, for a 1-year period beginning January 1st, 2017, for 1 year and ending next year, and authorizing 2 annual renewals without further resolutions in form, approved by the county attorney. And we had two bidders for this, and you saw that with the sheet that was transmitted. And the only situation, the reason that Bonadio was lowest was because the other bidder gave a range of services, which would have, in the event they were charged the top of it, which kind of oftentimes I think looks like gives you permission to, you know, to charge that amount. So Bonadio was the low bidder.
Patricia, have we worked with Bonadio before? Have they been?
Yep, Tammy can speak to them personally, but we've not had any issues.
Okay, good. So,
Motion to approve made by Supervisor Stroud, seconded by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
Okay, we would also like to request a resolution to renew our contract with New York State Department of Health for early intervention for a new 5-year term, commencing October 1st, which obviously is come and gone, but we just got the information, we just got the renewal, and annual amounts of $24,644. We've gotten this grant for a number of years, and we just send in a budget every year, and they give us, you know, obviously, they don't pay it until the budget is approved, but we pretty much use the monies to offset salaries.
Okay. Motion made by Supervisor Frazier, seconded by Supervisor Simpson. Any discussion? All in favor?
Aye.
Opposed? Carried.
We would also like to request a resolution to amend our contract with Glenn Shelby Animal Hospital to reflect an increase in rates effective January 1st, 2017. And if you look at attachment 7, it gives us the comparisons, and, quite frankly, they haven't asked for a rate increase since 2005, so I think that, this certainly is warranted, and if you look at the amounts, it's not, a lot more.
Motion made by Supervisor Bramer, seconded by Supervisor McDonald. Any discussion on this item? Yes, Supervisor.
What is going on here? I haven't seen one of these before. Why do we have a
Why do
contract?
we have rabies, if we-
Oh, that's what this is about, okay.
Right. Yeah, if we have a rabies specimen that has to be prepared and shipped,
Gotcha.
we don't have a lot of takers for that, because it's not real popular.
Like, what are we doing? We
I know,
have-
I was just thinking, oh, we just went through the whole
SCBA
thing.
contract.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
Our last resolution request is to transfer funds, and so Dawn would like to talk about that, attachment number 5.
Attachment number 5 is the request for,
Duplication of,
transfer funds. I just wanna explain, the first one that I'm asking for, speaking of the rabies program, is, I'm asking to move $10,000 to pay for, one thing that's come up, which is fairly new, is, we have a family that had exposure and had to get rabies vaccine, and their insurance is billed through the hospital, if possible, if they have insurance, which I, knock on wood, we haven't had anyone without insurance for quite a few years now. The thing is, as you know, a lot of insurances now are offering you lower premiums, higher deductibles. This is a family who had a $10,000 family deductible, and we happen to be the one that's gotta meet it. So, I've already been billed for the mother and the father, which I'll tell you, their deductible was probably over $7,500 that I have to meet, and I still have to be billed for the daughter. We only get like less than $15,000 a year from the rabies grant to go towards both what you saw, the animals that are sent away, and pays for the clinics and pays for human vaccine. So I have to move money because I have to pay this. This will be due. It will fall if it can't be paid by the grant fully, which it won't, because I can tell you that already. What will happen is it will fall under our state aid, General Public Health Works, and hopefully, in talking with Tammy, hopefully it could be 100%, whatever that difference is. If not, worst case scenario is 36% will get paid by the state aid. I have written the state, hoping that maybe, they have made changes in the past. They used to limit us with the animals that were euthanized and stuff. They used to limit us, like, you only got $25 for a bat, and it would cost us like $50. Now they just say, you know what, you got $15,000 for the whole grant, spend it as you can. Unfortunately, the human aspect of it is usually what? Most of the cases, I'm gonna say 99%, are people who have a deductible of $50 or copay. We're responsible for that because we don't want these people to go without getting their vaccinations if they were exposed. This is the first time that I've gotten anything that's this big. So I like I said, I've written the state, hoping I'll get an answer to see if there's some way, maybe give us more grant money, possibly. I mean, since this is a new and upcoming thing, we're seeing a lot of insurances, higher deductibles, lower premiums that people are taking. It just so happens we fell into the bucket that these people hadn't met their deductible yet, so it fell on the rabies vaccinations if they were at the hospital. So, I mean, and then I can give you an example too. Now, this family had a $10,000 deductible. We had another person who their total bill was over $30,000. By the time they billed insurance and adjusted it, our cost was $1,500 afterwards with his deductible, and so that was probably one of the highest ones I've had in a long time too. Most of them, like I said, are like $50, $100 and they have to go for a 4-shot series minimum. Once in a while a 5, but that's rare. So in this case, I just got these bills from the hospital. Like I said, I've only gotten 2 out of the 3, but I don't have the money to pay this, so I just need to move some money to pay for that, and then submit what I can to the state, and then the rest will go through state aid. So I just wanted to explain that that's the first one that I'm asking for, because I just got those bills from the hospital. If anyone has any questions or anything.
So, Ton, anytime somebody gets bit by a rabid animal and goes to the hospital and has insufficient insurance, we have to make it up? All right, just so I understand, okay?
One quick caveat is this is where it's so important if we're able to catch the dog within the 10 days and verify that it's healthy, we don't have to offer treatment.
if we have the rabid animal that we can test, or we have an animal that we can test, if it's negative, we don't have to offer treatment. If it's positive, obviously we have to offer treatment, but that's where the rabies coordination piece is so important, and the previous resolution that was just approved is important, and being a team member with the vets and animal control officers. People wake up with that in the house, and they think the best thing to do is let it out, and then we don't know if they were exposed, and so that's another one we have to do. We did have one that we were not popular on in the past month, actually, that there was an incident with a bat, and animal control was called. They couldn't find the bat. Person went back to, they were an out-of-state person up here on vacation, went back, got post-exposure treatment because their doctor authorized it, and they were looking for us to pay the balance, and we didn't do it. I wrote them a letter and said, we checked with the state, and we're not obligated to pay it if it's not pre-approved through us, and I know that our communicable disease people spend a lot of time trying to get things squared away so that when they do go back from vacation, that we have a mechanism and everything is in place, but they can't call us after the fact and expect the county to pay. So, I don't know, we haven't heard anything since I sent the lady the letter, but I'm sure she was prepared to have stuff. But that's the kind of thing that when we don't have the animal, and you can't have a do-over with rabies, unless you.
Supervisor Leggett, did you have a question?
How much does it cost if you're exposed, and how much does insurance cost?
You could probably, I can tell you, the one person I was just saying, the hospital billed over $30,000 for one person. It's the first shot.
For what?
For, I don't know, you might wanna explain that. They get 4 shots, but that first one is the most important and has the most amount of, I don't know, the medical end of it you can explain.
Holy smoke.
Yeah,
They're very expensive.
There's 2 components to the rabies treatment.
Why are they so expensive?
We're kind of at the mercy of the manufacturers of the product that we use. There's 2 components to rabies treatment. The first is an immunoglobulin product, which is passive immunity that gives you immediate protection within 12 to 24 hours. That kind of lasts about 3 to 5 months. The rabies incubation period, which is the time you're infected to the time you could come down with symptoms, could be up to 6 months. So they also offer the rabies vaccination series, which can be 4 to 5 doses, as Tom has discussed. That's an active immunity where we give you a shot. Your body has to produce antibodies to fight that, and that takes about 2 weeks to give protection, and it goes about 2 years before it starts to wane. So you really need both products to kind of protect somebody from a rabies exposure.
The other thing with
So
that is
excuse me, so that's about $6,000 a shot.
Well, the immune globulin product is based on weight, and that's the most expensive. The rabies vaccination.
The person's weight or the weight of
the
the
person,
shot?
the person's weight. And then, the rabies vaccine is more of a fixed cost. I don't know the exact.
I think, like, our cost for human rabies vaccine is somewhere around $200 for the vaccine,
and they get 4 to 5 doses of that, but if it's done at the hospital, you get the, like, pharmacy fee, the nursing fee, the.
But I will say,
We're
this is
being ripped off.
well, I'm gonna tell you,
Get
this
it,
is
Greg.
the first one that all the rest have been, I've gotten many bills that are like close to 20 to 25,000. But the problem, that's not a problem, we don't pay that. They bill the insurance the 25,000. The insurance, let's say they have a contract with them, and let's say it's a Blue Shield, and they pay $800. The hospital accepts that payment of $800.
Out of 20,000?
Yep. Well, it's per shot, they might pay $800, let's say. Then the hospital adjusts off the difference, because they have a contract with this insurance company, and then they only bill me, like I said, the person's copay, which might be $50 a shot. So I might have, or it could be 0, there might be no copay, and they paid for it all. So I can tell you, I've been here almost 13 years, I've never had, where I've had to pay 25,000. And the other thing too is if someone doesn't have insurance, the hospital, we have a agreement with them that they will bill us at the Medicaid rate. So, and that could cost anywhere from $1,500 to $2,000 too. And so I can pay that, but that's what we do with the people who don't have insurance. They go to the hospital for that first one, which Janelle said is the most important one, that's more expensive, and then they come to our office for the other 3. And so that saves. And again, I can bill the state for that, for our costs and our administration time to do that with our nurse. It's just the other ones, when they have insurance, the hospital can bill. And like I said, I've never gotten, bills like this. This is because it's this new I hate to say it, the new insurance where they're lowering premiums but higher deductibles. We just happen to be the one that got stuck with the deductibles at the end of the year. I mean, they've met maybe some of it, but I've already been billed, like I said, over $7,000 just for 2 people. And I had the hospital verify that and give me proof, and they went in and gave me the information that showed that the family deductible is $10,000.
And that's no negotiated rate, that's their straight rate, where...
And that's what the insurance says you have to collect, right? But again, like I said, I've written the state hoping I can get...
Aren't you glad you asked the question? Supervisor Bramer.
Thanks. So maybe going forward, I mean, this is a suggestion I'm throwing out, is that we make people come to the office and do the other 3 shots so that we avoid this potential
If we can,
pitfall.
in this case, I guess, if we can find out if their insurance, what kind of deductible or what kind of copay or whatever the case is, usually we give that information, the information goes right to the hospital. I don't know how that works.
I think sometimes you might make out worse, because if their insurance covers it and we're only paying the $50 copay and the vaccine costs $200, we'd be better off paying the
But can't you bill the entire $200 to the state?
If we haven't met, I've got the rabies grant first, I have to bill the rabies grant, everything has to go through that first, and once I've met the maximum of the rabies grant, which starts in April, so it's April to March.
Then we're stuck with it still?
Then, well, I have to pay it through the rabies grant. If I can't, then it goes with the county, and then it goes through our state aid.
How can we find out if they have insurance?
Well, we know if they have insurance, it's finding out what their, I guess, information is, their deductible or copay.
Yeah, we need to start doing that.
And most that.
Because the county just is offering the high thing.
Right.
High deductible, low premium thing.
Yeah.
So it could be, lots of people are gonna be
Right,
in
and
the same boat.
that's why I wrote the state too, to try to find out how they're gonna handle this in the future. They have changed, like I said, with the animal thing, used to be limited, and then they just opened it up. They may increase the grant, they may make other suggestions as to what we could do.
And there's a possibility we could bill insurance, but there's 2 issues with that. The first is some insurance companies, MVP being one, don't recognize Warren County as a provider because they feel like all their patients should go get immunizations at the doctor's office. And this is a vaccine doctor's offices don't cover. So if they showed up to our office and we were billed insurance, it'd be a lot of spinning the wheels, but we wouldn't get the revenue back because they denied payment because it's not given at the provider's office.
A lot of doctors
The
don't want to
second-
be bothered with having the vaccine in their office, so they just don't have it, it's easier to
The
do.
second issue is that first appointment, that they do at the emergency room with the H room or the immunoglobulin product. If somebody had a vicious front bite or a vicious clot bite, half of that dose has to be administered in a wound, and you want it as soon as possible after the wound, and we don't have nurses that are here at 2 in the morning.
I'm not saying that one, I was talking about the follow-up ones.
I think the issue would be we could look in to see if we're able to I mean, we can go through the rabies grant, the state aid grant, but it'd be nice if we could even bill the insurance, but I'm saying that's probably not gonna happen 100% of the time, because you go through pre-op situations, you go through denial of payment because we're not a provider in record, and that can get a little sticky, and then we end up losing money, especially if it was something we wouldn't have had to co-pay for, or we'd only have $50 to pay for. But, I mean, we can come up with some type of...
I think you must already have forms that you collect that info. You need to start adding that data as an item to be collected and analyzed.
Supervisor Seaver, you had a question?
I do, I understand the situation at hand, but what I'm wondering is, and I don't agree with it, but what I'm wondering is that 10,000, the way they negotiate with an insurance company, the fact they're not doing that with the county, I think is ridiculous. And I'm wondering if we could refer this to legislative and talk about forming a letter to our state and our federal representatives, to really start looking into this issue. I think that we can't be the only county in this situation, perhaps reaching out to NIFAC, but that could be a considerable impact on the budget, going forward, particularly with that type of insurance, but.
Like I said, 99.9% I haven't had, this is the first time I've had with one of these, what I call new insurances, or lower premiums, higher deductible, kind of. And, like I said, I contacted the state, haven't heard an answer back yet, but
And I just don't know why
interested to see
we
how.
have to pay the whole thing for that one item, when typically that would be an individual paying. I mean, that sucks for the family.
I guess it's because it's a public health issue. And so whenever it's a public health issue, especially with rabies, if you were to say to a family, oh, you have to pay $3,000 to get a shot, and they say, well, I'm not paying it, and then they don't get vaccinated, and then we have a public health issue.
Right. The hospital should still do that.
The hospitals work very well with us, and maybe this is something we can go back and ask about these kind of things. I just don't know how it works with, I know with us, you know, if a patient's insurance says that you're supposed to bill a copay, then you're supposed to bill a copay. That's part of the policy, and that's part of the regulation with that insurance company when you're
Well, we could have a
member
law
with them.
saying if it's a public health issue, then it gets back down to the county as a full
Patient
payment.
deductible does not apply.
Yeah.
Or something like that,
Yeah.
because
Yeah.
in fairness, if, like Tawn said, if they do not get treated, then it's a public health issue.
Right.
And that is why we cover, because typically, you know, you have a home care patient. We bill copays to our home care patient, we would bill a deductible to our home care patient. This is different, this is public health, so because we're public health, we kind of hold the patient harmless for this, and that's law. So that's why we do it, and you know, all counties are doing the same, so I think that's a great idea. NITEC might be the avenue, because we're not, and now that the insurance marketplace has changed so dramatically, that might change back again, but anyway, since it's changed so dramatically thus far, everybody's gotta be in the same boat with these situations, and you're not gonna not treat a family because it's rabies.
We've had, rabies, the idea of going to legislators. This is not a bad idea. It might go the same route as early intervention did, because the state wants to be the payer of last resort. So if you have a situation where a person has insurance, maybe in the long run it'll come out. Like early intervention, we've always said children, for example, that need speech, that should be covered by medical insurance, and it's been since 1993, and it's still not straightened out. It's still a pretty big expense, but not a bad idea. I mean, nothing to lose.
Well, certainly is something we need to watch and maybe keep us updated on, and then it might not be a bad idea to move it on to legislative and,
Can I make that motion on this?
sure. You want
So they should move it on to,
okay.
we do, right? Don't we have to make a motion to move it to legislative, or
I don't
we
think you
can
need
just
to make a
request
motion, but
it? Oh, yeah?
I thought you were making a motion to approve the transfer of funds.
Oh, so I don't wanna do that.
I don't want
I know it has to happen. So we can just move it on to John's agenda for this.
Well, somebody's gotta draw up the format of what the question is, and I will assign you to do that.
No problem, I'll let you know that.
Did you wanna discuss more of the items, Tawn, on the transfer, or is the committee comfortable with making a motion to approve the transfers? Motion made by Supervisor Stroud to approve the transfers?
Yes.
Okay.
We don't have any choice.
No. Seconded by, Supervisor McDevitt.
Sorry, just have one thing.
Yeah.
What's the 75,000 about?
That's, the 75,000 and the 10,000 are our contract where we pay our therapists. Our budget, we haven't got enough to get through the year, so I'm trying to analyze to see, so I'm moving money to get that paid for the end of the year. Actually, what we budgeted was less than what we actually paid last year. I have a feeling it was probably due to the end of the year cuts, and they said take away, but we need more money to cover those contracts. So I'm moving the money, out of our full-time salary line where we have some extra, and out of our, hospitalization, where we have some extra, all within the CHA, and moving it just from there up to contract expenses to pay for those therapists to the end of the year. Usually this time of year, I hate to say it, you start seeing where things start getting at 90% or 89%, and so we have to think quick and move money if we need to.
Just, I don't wanna ask too many questions about this, there's been a lot of discussion, but the line again of the $10,000 deductible, if this person had initially gone to the hospital,
Well, they do go to the hospital, but it has to be approved by us. No one can just get bit and go to the hospital.
So there's no way where the hospital would be on the hook for the $10,000 deductible. It just, the way the system works, it flows directly to, because
well, in a rabies case, yes, it comes to us.
Comes to the county.
Right.
That's the level of
Only in a rabies case.
Okay.
And I work very closely with it.
Public health.
Well, yeah, a few, right.
Tuberculosis.
Yeah, but we haven't gotten any, thank God, big things on that.
Okay.
Okay, we have a motion and a second, all in favor?
Aye.
Opposed, carried. There's hardest transfer of funds I've ever done in my life.
We try to share all of our
I knew it was,
That's
it is.
incredible.
When you think
I had no
30,000
idea.
for one person,
That's a scary trend to see that it's gonna keep happening that way.
Okay,
Okay.
Okay, moving on, we don't have any pending items this month, and moving on to, attachment number 1, which is our monthly emergency response and preparedness activities report. Questions on that, we can move on to status of referrals. Tammy's going to talk about that, Val's on vacation.
October was a big month for us, for our referrals, which is good, 'cause we were down a little bit we were down the month before, so, it's one of our biggest Octobers that we've had, so that's good, and right now, our nurses are incredibly busy, so I'm thinking, that November's probably looking pretty good too. This is one of the real values of having our per diem nurses, because we're able to be a little bit fluid, with our nursing staff, because we're able to call in the per diems when we need them, but yet not call them in when we don't need them to go out to make the visit, so, it's been working very, very well for us, and everybody's happy. They like working a few days a week, and, fully trained, it's nice, because it allows us to really treat this like a business model, and get the staff in when you need them, and you don't have them in when you don't need them, so, it's going very well.
Moving on to expenditures and revenues and overtime. Con?
on again. Attachment number 2, which is our financials as of, the 15th of November. We haven't finished the October billing, we're doing that this week, so hopefully that'll close. I did accrue in the revenues, it's the end of the quarter for September, that we, had our Ebola grant ended September 30th, and the final voucher for that, and, bioterrorism and our lead, our rabies program, and our IAP grant, all of those, I accrued into our revenues above. Our salaries, comparing again last year to this year, you'll see that we are at 75.5% of the budget with, salaries as of November, which is very good. Last year at this time, we were at 84.61. And, you'll see that we're, again, down in our full-time and our overtime, which is wonderful, and that's all, like Tammy said, due to our per diem staff that we're utilizing, which has been great. On attachment number 3, which is comparing last year to this year at the same time, again, you'll see it's the same thing with the salaries, and revenues are down, we haven't billed yet, we are down a little bit in revenues, but we are down in expenses too, so as the year goes on, we continue to see where we're going. And the other thing always to remember is that our revenues no longer reflect and expenses reflect, long-term care program, which is closed as of probably around June 1st was our last patient. So those revenues for a half a year and those expenses for a half year are no longer reflective in current. We continue billing and, well, again, to remind you too, our preschool program, the year starts July 1st and goes to June 30th, and we can't bill most of the new school year until around March of 2017. So when we do all that, and we'll reflect that in our 2016 revenues, but they're not here right now when you look at year-to-date last year because we have to wait until March before we get that information from the state. That's it.
Any questions or comments? Anything else, John?
That's all we have.
Everyone have a wonderful Thanksgiving. Motion to adjourn made by Supervisor Strauss, seconded by Supervisor McDonald. All in favor?
Aye.
Opposed? Carried. Thank you.
Oh, it's your turn. My turn.